Now, rosacea is a common skin condition which mostly affects people aged between 30 and 50. Today we're taking a closer look at what the condition actually is and how best to treat it. Dr. Rosemary Coleman's back with us. And Brian Houston, you're both very welcome. Firstly, why 30 to 50-year-olds? Why is it most common, or do we know?
It just is.
Just one of those things?
It certainly is, yes.
And what is it?
It's a cause of inflammation in the skin, which typically occurs in the central facial area. We call it the butterfly zone.
Okay.
And it's more common in women, and it's more common in people of Celtic origin.
So in Asia and Africa, they don't seem to have it at all?
No, very rare.
People who are prone to blushing are getting very embarrassed. Is there a connection there?
There can be a connection. Blushing and flushing is one of the common symptoms of rosacea, but some people will have predominantly blushing, other people will have predominantly spots.
Okay.
So there's a spectrum in the disorder.
And is it something, I mean, you probably dealt with so many of your patients and clients who have come in over the years. Is it something that gets them, it's a little bit more embarrassing when it's on your face. It has to be difficult for them.
Absolutely,
Yeah.
absolutely. Particularly as it occurs in adult years and in the professional world. You don't want to go into a meeting with spots and people not take you seriously. It's very embarrassing.
Brian, was it difficult when you realised what you had and you're probably going to have it for life?
Well, from my mid-20s, really, I had rosacea, and I never had a period where my kind of adolescent acne and stuff cleared up, and I had a good period of skin. But into my 30s, when it started persisting around into my 30s, that was when I thought I really had to do something about it.
Did anything bring it on, or did it just happen?
I never really found a trigger or a stress thing. Some people say red wine, coffee, all those kinds of things. None of those individual things did it for me, but I know in times of stress it was probably more aggravated than at other times.
Now, looking at you now, it's not too bad, but how bad has it been in the past?
It's been an upsetting condition to have. From my mid-20s, a lot of redness around your face, as Dr. Coleman said, a butterfly sort of zone, on my forehead as well, lumpy, uneven skin, and nothing you can do about it. I suppose as a woman you can use makeup and cover up. And in fact, I went to my GP in my 20s, and the attitude very much at the time was, well, you know, if you're a woman we might be bothered about it, but as a man, just get on with it, sort of thing.
That's a bit unfair.
I thought so too,
Well, it's very sexist, actually. That's completely unfair. And is it something that you feel, I mean, you're very confident here, and I spoke to you before we went on air, and you seem very confident, but is it something that held you back a little? Were you a little bit more embarrassed at times?
Yes, it was. Dr. Coleman mentioned about going into meetings, and when you meet people and you make a first impression, you don't want your first impression to be rosacea, and it was like that for me for a long, long time. So a couple of years ago...
Anybody out there with skin condition could relate to that.
Absolutely,
you know,
yeah.
Absolutely.
Yeah.
OK, let's talk about the symptoms. What kind of symptoms are there, and how bad can it get, Rosemary?
OK, well, again, there's a spectrum. So you can have very mild rosacea with just a little redness of the nose and a few little pus spots, but just constantly appearing, all the way to an entirely inflamed face with big lumps, bumps and boils.
So the redness can get very bad?
Absolutely.
We have some photographs here of or how bad it can get. That also looks a little bit swollen as well. We might get that monitor brought up, sorry, Dennis, just so we can see it properly. Now, the next one is dryness, which people would associate with a lot of skin conditions. But how bad can it get? Oh, that's very bad.
Well, people with rosacea tend to develop a sensitive skin and become very intolerant of topical preparations and all makeups and cosmetics. And they'll often come in with a number of conditions at that stage, a bit of contact dermatitis, a bit of seborrheic, a bit of rosacea, and they're all triggered, and it becomes a vicious cycle. If you calm down the rosacea, you get everything under control.
OK. And the fact that you can have pimples as well, is that the connection with acne, maybe in puberty?
Well, it used to be called acne rosacea. And a number of people will actually have acne and rosacea. This unfortunate lady, again, you can see this butterfly distribution, particularly on her cheeks, but big swollen cysts on the lower part of her cheeks. And indeed, these can actually result in scarring when they're very severe.
That's quite bad.
That would be a very typical case. This is very typical. Central face, pustules, lumps and bumps. And that person had a lovely smile on their face despite that.
I know, it's fantastic. But, and that redness is so red.
Yeah, the redness is very distressing because not only does it look bad, it feels lousy. It feels very hot and uncomfortable. And when the people go from a hot to a cold environment or a cold to a hot, they can get a lot of flushing and burning and feel very distressed. So it's a very uncomfortable symptom.
God. And those red lines that you often read about when it comes to rosacea is quite common, actually, the red lines.
Well, what happens is, with the recurrent flushing and blushing, the blood vessels keep opening, closing, and eventually they give up and they become dilated. They're called telangiectasia, or thread veins. But again, the great thing is nowadays we can do so much about those, but they are unsightly.
Just before we finish on the symptoms, I'm intrigued with the swelling, especially around the nasal area, around the nose. Those nasal bumps, it looks infected. Is that what's happening there, or is it just swelling?
It's predominantly inflammation and not primarily infection. And it can result with this gentleman in what we call a rhinophyma, which is a pronounced thickening of the tissue of the nose, which is a permanent defect. So it can be very unsightly, and other areas of the face can become thickened. So it's good to get in there early and switch off the inflammation. So
early diagnosis is the most important thing. You're having treatment at the moment,
That's right, that's right, under Dr. Coleman, that's right.
What is IPL, Dr. Rosemary?
Intense pulse light therapy. It's a type of laser treatment, but it involves the heat being absorbed, the laser light being absorbed by the blood vessels, and the heat damages the blood vessel wall. It both helps the broken blood vessels, but it also helps the active inflammation. It's quite a good anti-inflammatory condition. It shrinks down sebaceous glands, so it can help the spots and lumps and bumps as well as the redness and the broken blood vessels.
Have you found this to be quite successful?
Very. We often use it in conjunction with medical therapy, particularly for severe cases.
There's a before shot of that laser treatment.
Yes, severe telangiectasia, yeah, very severe. She was very distressed. I'm not sure if that shows as well, but she was absolutely delighted.
It's the light, but I can see it. I can obviously see there's a huge difference. Brian, how are you finding the IPL?
Fantastic. We use it in conjunction with other medical treatments. I was on a course of antibiotics at the beginning, and once the condition comes under control, really, you're starting to work then on getting it as good as it can possibly be. And the IPL, it looks a little sore, but it's not really. It's wonderful and absolutely worth the benefits.
And afterwards, you're leaving the room and you're going back to work, or you're functioning
There's
normally.
There's no downtime. I thought when I first went in that I'd come out a little bit marked or red or something like that. It's fine. Straight back to work, straight back to meeting people.
How do you react to the sun? How does the sun react to this? You know, with psoriasis, because I know psoriasis loves the sun. The sun loves psoriasis. What about rosacea?
No, it doesn't.
The opposite.
Well, again, you know, everybody's different, but for at least 60%, they may not even realise that they're photosensitive. So I'd routinely like them all to wear sunblock in the morning.
Well, I remember the first time I met you, you told me everybody should be wearing sunblock,
well, that's true.
even on a day like this. Don't ever presume. Now, the few items we have some products here, firstly, that are recommended over the counter.
Yes.
But I presume your initial reaction would be go to a doctor, get diagnosed as soon as you can and get it sorted.
True, but you know, you're recommending good ranges of products that can be helpful at home.
Okay, which is brilliant. Also, on the other side of our coffee table, we have some items that you feel can trigger, depending on the person. It's all different. Red wine, hot food, that kind of thing, chilies.
Anything that causes vasodilation really can set off rosacea and make people very uncomfortable.
What about stress, Rosemary?
Absolutely.
Is it a factor?
Yes, it is. I spent many years saying it wasn't, but stress aggravates most skin conditions, but it certainly aggravates rosacea.
So incredible. So stress over and over again, stress comes up. I see there also excessive exercise, which is an unusual one to see.
Well, again, if people get very hot and bothered, you know, some people will find that they have to tone down their exercise because they don't like the amount of heat it generates. But usually once you control the inflammation, once we control it with drugs, they can get back to an ordinary exercise regime.
So at the moment you're on medication and the laser treatment?
I'm off the medication.
Oh, you're off the medication.
The only thing I do at the moment is I use one of those La Roche-Posay washes in the shower every morning.
Which is great.
I use... then I go for the IPL to Rosemary's clinic every once in a while.
I'm sure there are a lot of people now watching this that can relate to it. And they only have maybe a little spot around their nose, a little bit. But it doesn't matter how bad it is, I'm sure or how small it is, it's an issue for them. Yeah. What about makeup for women? Is there anything out there? Is it still being researched?
Well, that's a good point. The problem with rosacea is that people tend to have a very sensitive skin. And often by the time they get to me, they often end up being able to use absolutely nothing on their skin. And literally, I recommend milk as a cleanser for people who end up unable to use anything. I say, let's start again with milk from the fridge. Or even just plain glycerine as a moisturizer. And as the inflammation reduces in their skin, they become desensitized, and then we can introduce some of the cosmetic ranges. So the makeup, which is very important because it's a camouflage for the women, the makeup is very much trial and error. There is no one range where you'd say, okay, use this in your plain sailing. Everybody has to check out what's going to work for them and not irritate them.
But it's good news for you, Brian.
Well, it's easier for guys. We just have to
not
cleanse
at all.
and hack on.
I don't agree at all. No, you're doing great on it, though. It's really working
It's great,
for the
and the
IPL.
benefits of it are so good. Now, when my skin is bad, it's nowhere near as bad as it used to be, and it's a lovely, lovely thing
Which is
to
brilliant. And
have
good luck with
improved
the
that way.
treatment. Thanks a
very
million for
much.
coming in. Thank you, Dr. Rosemary.
Thank you.
Now, all the details, of course, about all the products and all our tips are on the website rt.ie/The Afternoon Show. Dr. Coleman, you're back next week. We're going to talk about eczema for children, or eczema. It varies. People pronounce it eczema, people like eczema, for children and for adults, so don't miss that, Shana.